Now when we talk of secondary prevention, for instance, we do the master health checks. Mundila 40 vayasku mele health checkup pannun solvom. Ipo we actually advise even from 30 years old, because people's lifestyles have changed so much that we would like to find out if there is anything we can correct before symptoms start, so that we can prevent complications or even cure a problem. When you're talking of lifestyle diseases, we are talking about obesity, insulin resistance and diabetes, hypertension, hyperuricemia, in the uric acid area, again like I said, because of unhealthy protein choices. Then cholesterol factors, many people the good cholesterol is low. Idella நம்ம முன்னாடியே detect பண்ணினோம்னா we can address it again with the above three which I have mentioned: the diet, the exercise and the sleep patterns, which you can make part of your lifestyle, so that we can reduce the worsening of these lifestyle diseases, so that we can live longer, more productive lives. Another thing, when we're talking about secondary prevention, we've talked about lifestyle diseases. I would like to talk about the infections which are going round right now. I think Dr. Vaishali has talked about the vaccines. I would like to emphasize that we do have vaccines for adults, and we do want people to have it. Mundi mari childhood immunization order போராது. Like we have all seen in the last 4 years, COVID has taken a toll. So just like the COVID vaccines, we are also seeing multiple endemics, epidemics of flu. So an annual flu vaccine, especially for senior citizens and with people with immune deficiencies, is important. Elderly age group, I want to emphasize the vaccine for shingles. Vaccine vandirukku. The shingles or akkingiradhu, it gives a lot of problem. The acute episode is one part of it, but senior citizens ku adukaprom the nerve pain which is there, which lasts for a very long time. So these are the main factors I want to address for preventive health care. Again, for senior citizens, we are talking about two other issues. One, detecting cancers early. If you have a family history of cancer, you have to come to us at the first sign of any change in symptoms. For instance, bowel symptoms. If you are prone to having a loose motions or a very frequent motion timing, suddenly you are developing constipation, or the stool is becoming very thin, narrow, hard to pass. This is one reason you have to check immediately. Again, if you have any difficulty in swallowing, or you're losing weight, or you're suddenly having anemia, again the upper stomach cancers we have to think of. Third, we are talking of prostate cancers in men. Any change in your urination, if there's a frequency in urination, if your stream is lower, if there's any dribbling, this also we want to check out the prostate. And along with doing the ultrasound, we will do a diagnostic test, the PSA. It is a tumor marker. So idella, like I said, this is also part of secondary prevention, where we are trying to diagnose and we are trying to catch it early, so that you don't progress to problems. Besides cancers in older age group, again it is important to think of bone health. Please keep exercising regularly and make sure your homes are very comfortable, so that you can prevent falls. So in the bathroom or near your bed or anywhere else, pudi vechikongo, so that whenever you're getting up, make sure you're well supported. Try to slow down a little bit. Don't be in a hurry. Don't wear your clothes standing. If you're wearing your trousers and all, உட்கார்ந்து பொறுமையா போட்டுக்கோங்க. By this means, you can prevent falls and you can prevent long morbidity. For women, yes, the health issues are slightly variant. We are seeing 2 or 3 things from youngsters itself now, because again of their lifestyles, the sedentary lifestyles, the very high stress they are facing now, because they are also entered the competitive world. Because of these, we are finding 2 issues mainly: hypothyroidism and polycystic ovary disease. So if you're having any irregular cycles, weight gain, all this, again please consult early. Polycystic ovary syndrome is not just a gynecological syndrome. It is again a part of the metabolic syndrome. It is a metabolic disease with insulin resistance being the main factor, and very often very stress induced. So we need to discuss the diet care, the exercise and the lifestyle for prevention of this. Another factor again for women, we are talking about vaccines. It's important that all young girls, it used to be from 18 to 45, but I think now they're vaccinating from 12 years itself for prevention of cervical cancer. We want all the young girls to have this human papilloma virus vaccine, It's 3 doses for cervical cancer. Fourth, again when we're talking about cancer screening in the older age group, we need to emphasize a self-breast examination is a must. Unlike other countries, we don't push too much towards a mammogram or an ultrasound. Of course, if you have a strong family history of cancer, we need an annual mammogram or at least a screening ultrasound. But a self-breast examination is a must. If you have not learnt it or you have any doubts knowing how to do it, you can please approach your primary care physician. Women's hormones are very, very protective against heart disease and osteoporosis. So I find many women are not happy to have their periods. They want earlier menopause and so on. It's very, very good to have your menopause at 53, 54 because till then your risk of cardiac conditions and your risk of osteoporosis are very low.